been practicing now for 30 plus years. Low back is one of those conditions that I'm fairly confident with. It's not all back pain. Some cases of back pain are simply just beyond what acupuncture can do. I tend to, in my diagnostic process, try and divide them into back pain that is primarily muscular. Yeah, so there must be patterns of muscular trigger points essentially. It's off the top of my head, things like iliocostalis, quadratus lumborum, gluteus medius, piriformis. Those muscles are quite capable of generating a lot of pain, as are the multifidus muscles. They can cause a fair bit of pain too, and they all respond really well to acupuncture. In fact, with the muscular, if I think it's a muscular problem and it's not better within 2 treatments, then I'm questioning that diagnosis. So they're the muscular ones, and they're often the more acute. But there are surprisingly some chronic presentations of low back pain that are essentially muscular, particularly things that are aggravated by the same activity. So people who are triggering them off by driving that they do for their jobs, or often occupational kind of things. So that even if you fix them for a while, it'll tend to come back, and so you need to find out what they're doing and to change that. The other major category is what I call the joint-related back pain, which is facet joint and disc related, really there. And really, I think this is the area where acupuncture really has a major contribution to make, just because it really does stimulate the repair of the tissues. It's not just an analgesic kind of thing. We're really helping to repair the problem, and it must be said, acupuncture has an ability to affect that what they call now central sensitization, where the presence of nociceptive back pain triggers off changes in the spinal cord, neuroplasticity within the spinal cord and brain, and you get a kind of a back, a type of pain that persists beyond the normal nociceptive back pain, which is to do with tissue injury and whatnot. And acupuncture has a powerful effect at both of those levels, so it can help repair and also help to sort of change the neural networks, if you like, in the spine and central nervous system. Either or both can lead to a fairly satisfactory resolution of a problem. And I tend to, when I get it right, I expect to see patients start getting better after 1 or 2 treatments there. If it's not happening after 2 treatments, I'm seriously questioning what I'm doing. Now, one of the things that I've noticed over the years is that, diagnostically it's often difficult, particularly in the absence of leg symptoms, because it's the leg symptoms that make it easier to determine which segment that you need to treat, that sometimes I will get the segment wrong. So I'm not getting anywhere, and you send somebody for scans and it turns out to be an L4-5 problem rather than an L5-S1, or an L3-4 problem rather than an L4-5. And so I change the segment that I'm treating, and all of a sudden the response improves. So it's, you know that you're having an effect when you do that. It's not just a placebo thing, and it's a fairly permanent, these are long-lasting results. If somebody comes in, as happens all too rarely, I can say it's probably only happened to me that I know of 4, 5, 6 times in my practice life, where somebody has had decades of pain and come in and been, after a single treatment, just recovered, then what is almost certainly happening is that you switch something off in the spine. That's a neuroplasticity thing. So it's not really the effect on the spinal tissues, it's the effect on the neurology, if you like, there. And acupuncture is more than capable of doing that. But as I said, that's a rare situation where that happens. What's much more often with chronic pain is that you get you establish that you're on the right track, and you need to follow that along for 5, 10, 15 treatments, and often you get to a point where they're pretty good. They're either got no pain or entirely manageable pain there. And so these are so often situations that would never be considered for surgery. So they're like your common or garden low back pains there that people grumble along with and manage with pharmaceuticals often. Moving through into the more serious disability where it's affecting their ability to carry out activities of daily life and to perform perform their work activities there, right up to cases that could be considered in some surgical cases that I've certainly in my time had many cases who have been scheduled for surgery who have responded very well to acupuncture treatment and no longer needed that surgery. For really chronic back pain, well, if it's been there decades, certainly helping management is more realistic. But if we're talking about something that's been there for, say, between 3 and 6 months, that's a period where you really need to be trying different treatments. You really need to be trying to avoid that pain setting in as a chronic condition. They're the cases that might not get better if they aren't treated successfully. Less than 2 weeks, I won't even book some of those people in. You go, don't worry about it, you'll be fine. Acute back pain doesn't need treatment. Most acute back pain is self-limiting. But once you get into the sort of 3-4 weeks and plus, and less than say 12 or 20, but certainly that 12 weeks, that 3-month period between, so let's take it all the way up to 6 months, between say 1 month and 6 months, that's a period where really all treatment options should be explored. And acupuncture is definitely one of the treatments that should be included in anybody's program of management or exploration.